Hi, my name is Katie Roster. I'm currently a third-year medical student at New York Medical College. Thanks so much to the selection committee for allowing me to present this research today. And thank you to my mentor, Dr. Saeed Faraz-Kezem from the University of New Mexico Neurosurgery Department for helping me with this project. And thanks to Omar Tarane and Rachel Toman, who are also New York medical students at New York Medical College. So today I'll be speaking on the baseline 5-item modified frailty index and cranial neurostimulator procedure outcomes. None of the authors have any conflicts of interest to disclose. Cranial neurostimulators are a beneficial treatment for patients with movement disorders such as Parkinson's and essential tremors. They also have the potential to serve as a variety of treatments for a variety of brain disorders such as epilepsy, addiction, and obesity. And although these procedures are generally considered safe, there have been complications that have been reported, and these complications can lead to extended length of stay and non-routine discharge. So it's very important that we find and identify the risk factors associated with these adverse outcomes. The Modified 5-Item Frailty Index, or MFI-5, is a validated measure of frailty that serves as a beneficial tool in predicting outcomes in some surgeries. The MFI-5 has the potential to predict adverse outcomes following cranial neurostimulator placement, removal, and revision. So this study aims to evaluate the utility of using the MFI-5 in predicting outcomes of patients who have undergone neurostimulator procedures. So our methods, we used the American College of Surgeons National Surgery Quality Improvement Program, or ACS NSQIP. We used the database from the years 2015 to 2019, and we identified cases of patients who had undergone neurostimulator procedures during this time using current procedural terminology codes, or CPT codes. And we included the following codes. You can see the codes on the right-hand side that we used, and these codes encompass patients that had undergone revision, removal, or placement of cranial neurostimulator pulse generators. And you can see on the side here the codes that we used, and the code that we used the most was the placement of a cranial neurostimulator pulse generator. And once we had identified the patients that we're going to use in our analysis, we calculated an MFI-5 for each patient, and this MFI-5 score includes the following comorbidities. It includes a history of congestive heart failure, presence of diabetes, history of COPD or pneumonia, partially dependent or totally dependent functional health status, and then the presence of hypertension. And once we had calculated the scores for each individual patient, they were placed into the following groups: non-frail, pre-frail, frail, or severely frail. Binary logistic regression was used to evaluate the MFI-5 score as a predictor of the following adverse outcomes: major complications, minor complications, reoperation, unplanned readmission, extended length of stay, and non-routine discharge destination. The effect of age on these outcomes was also analyzed using a linear regression. And then the effect sizes were summarized using an odds ratio and their corresponding 95% confidence interval. In total, we had a total of 3,843 patients, and the median age of these patients was 60. And among these patients, 56.7% were not frail, 32.06% were pre-frail, 10.4% were frail, and 0.81% were severely frail. And the results from our univariate analysis found that increasing frailty was significantly associated with higher odds of readmission, and frailty was significantly associated with non-routine discharge destination. So as you can see in the chart there, the darker gray were the values that we found to be significant in our univariate analysis. So as you can see, readmission was significantly associated with higher odds of readmission, and then non-routine discharge destination as well. And then the results of our linear regression found that age was significantly associated with major complications and non-routine discharge destination. In conclusion, the MFI-5 may be a valuable risk stratification tool in predicting readmission and non-routine discharge destinations in patients undergoing neurostimulator procedures. And that brings us to the end. Thank you so much for your interest in this project, and thank you so much for your attention.